When the patient arrives at the screening station, verify that all the necessary boxes are filled out and that the consent form is signed. From here, you can begin to set up. You'll need each of the following: a bottle of hand sanitizer, a pair of gloves, an alcohol wipe, a paper towel, a cotton ball, a Band-Aid, a capillary, a lancet, a test strip, a cholesterol screening machine, and a nearby sharps container. When you have all of these items in front of you, you may begin the screening process. First, get the cholesterol machine ready before you obtain the blood sample. Each cholesterol machine will look like this. Turn on the machine by pressing the button on the left with the circle. The machine will alert you to insert a MeMo chip. The MeMo chip is what gets inserted into the top of the machine. Make sure that the MeMo chip you insert matches the lot number of the test strips you will be utilizing for the day. Once the MeMo chip is in, you may begin to obtain the blood sample from the patient. Make sure the patient's hands are warm for best results. You'll first put on a pair of gloves. Please note, a new pair of gloves is used for every new patient. Use the alcohol wipe to sanitize the area on the fingertip. Let this area dry to prevent stinging. During this drying period, grab the Band-Aid and remove one of the backings and adhere it to the glove. Place the test strip into the machine and follow the prompts until it says Apply Test Sample. By now, the area is dry and you are ready to prick the patient with the lancet. You want to avoid pricking the patient in the middle of the fingertip, so aim slightly to the side. Remove the cap on the lancet and proceed to push down on the clean area of the fingertip. Set the lancet down and use a cotton ball to wipe off the first drop of blood. Then, squeeze the finger to get a big drop of blood to fill the capillary up. Place the tip of the capillary in contact with the large drop of blood. The capillary will essentially act as a vacuum to gather the blood. Fill up enough blood to the line of the capillary. Once you have filled the capillary to the line, ask the patient to hold the cotton ball over the area while you apply the blood sample to the test strip. Place your fingers over the tiny holes on the line of the capillary and use your other hand to squeeze the blood sample onto the appropriate area of the test strip. Please note, make sure the capillary does not physically come into contact with the test strip. The machine will recognize the sample and begin to process. Now, you may turn your attention back to the patient and apply the Band-Aid to their fingertip. Let the patient know that it will take approximately 1 to 2 minutes until the results are available. During this time, you can clean up your station. Dispose the lancet and capillary into the sharps container. Please note, the only items that go into the sharps container are the lancet, capillary, and test strip. Collect all other trash and dispose it into the garbage bag. After obtaining results from the screening, discard the test strip into the sharps container. Finally, take off your gloves and dispose of them properly. When the machine has processed the results, record the readings of total cholesterol and HDL onto the cardiovascular risk disease form. Most health fairs provide patients with a passport card or handout to record all their screening results from each station. Be sure to record the patient's results onto this handout as well. Please note, a copy of the informed consent and cardiovascular risk disease form always stays with Operation Heart. It is okay to give the patient a copy of the informed consent, but please do not give them our only copy. This year, patient screening results are also being documented electronically into an Access database. Please make sure that the screening information from your patient is delivered to the Operation Heart co-chair or project manager who will be conducting the data entry for that day. You may tell the patient their total cholesterol score, HDL score, and calculate their cardiovascular risk. Please note, We are only screening patients regarding their cholesterol levels. We are not diagnosing them.